a lot. But oh, what a mixture of races and culture, that's what we've got. Still no major indifference.
A critical platform to strengthen regional cancer strategies by integrating clinical innovation, public policy, and patient-centered solutions. That's what Dr. Marissa Nimrod, the CEO of the Caribbean Association for Oncology and Haematology, is remarking on the 13th Annual Scientific Conference. This morning she joins us via Zoom to tell us more about the event, which is carded to take place from the 11th to the 13th of July at the Hyatt Regency. Good morning and welcome to the Now, Dr. Nimrod.
Good morning, Aika. Thank you for having me this morning.
Absolutely necessary, and it follows a conversation that actually is putting eyes on cancer in a different way. This time around, though, we are focusing on the professionals in the realm, I imagine, and with a number like 13, it means that there is some difference to this edition. Tell me what we can look forward to from the 11th to the 13th.
Okay, great. So this year we decided to come under the theme, Innovating for Equity, right? Advancing Cancer Care in the Caribbean. And this theme in particular reflects the board's commitment to bridging the gaps in access. Because anywhere you go in the world, there's no perfect healthcare system. There will always be access. So we're looking to see, ways that we can actually address some of the low-lying fruits in terms of trying to improve on the outcomes. We're looking at affordability. In terms of cost, a lot of people will say it's expensive when you get around to a diagnosis of cancer and having the treatment subsequent, and then improving, as we said, the outcomes. So cancer is the second leading cause of death after cardiovascular disease, and too many patients face late diagnoses and treatment delays or financial hardships. It's not something that you always have money put aside for. So we believe that if we could do innovation, whether we look at technology, policy, or partnerships, we want to have that strong focus on equity to transform the cancer landscape. So that is pretty much what we're looking at now in terms of, using resource-stratified guidelines and how we can improve care across the island.
Dr. Nimrod, that will take shape in what way? Because I know that in previous iterations, there were incredible speakers on panels, workshops, and even executions that people can interact with. What will we see this time around?
Oh, wonderful. Yes, every year we definitely try to beat the last year. So we actually have a keynote coming in, Dr. McCleary coming from Dana-Farber, Harvard Cancer Center, will be coming to speak about equity and innovation and access. We want persons to come up and interact with our kiosk, so you can come and touch and ask a question. We've been reforming reforming our AI, so persons should be able to come and interact with Joy and ask Joy questions, and she should be able to answer. So Melissa Pace is leading that out first. And we're also launching just a sneak peek of our breast cancer patient navigation app that we've been working on. So we're excited, to get it done. And then this year we'll be hosting our first medical or medicinal cannabis workshop. So that's something that we're excited and eager for persons to come and to hear the best minds from the medical cannabis authorities across the region.
Well, those are some very interesting conversations to be had, medical cannabis being one that everybody's going to want to pay attention to. But this conference is actually speaking to a number of stakeholders. So first off, tell us who is supposed to be, or ideally to be in attendance of this round.
So we normally try to make it, we say all-encompassing or multidisciplinary team effect. So it's targeted at doctors, nurses, lab techs, radiologists. That's normally the doctors and the allied health professionals. Right. But even so, there's something for everyone in there. There's even for just the patient advocate. So again, we have hematology, oncology, we have cardiology, Dr. Ronald Henry, Professor Simongal. On pulmonary, we have palliative care, Dr. Jackie Sabga. So we're making sure that we have a little bit of something for everyone in there. So as we normally say, cancer is everyone's business. So there should be something for anyone who chooses to come.
In that case, tell me a little bit more about that breast cancer patients app that you lightly mentioned, which sounds like a game changer. What does that entail?
Okay, great. So a couple of years ago, we actually started working on what we call our resource stratified guidelines based off of the African or sub-Saharan guidelines. And the thought process was that we're not going to have everything, so we decided to write it along with NCCN, the National Cancer Comprehensive Network, and find guidelines that were tiered to the resources in the Caribbean. So with that being said, in terms of navigation, sometimes people just need a step-by-step scenario in terms of what comes next, like a standard operating procedure. So we're hoping to put that into someone's hand, and you should be able to log into the app, put in your information, get general, information on breast cancer, and we take you step by step in terms of what to expect from screening all the way up, ideally, to palliative care. So we're trying to utilize the guidelines that we did, and we're trying to focus on persons in the community using this one so that they can have the step-by-step access and try to reduce the gaps with respect to treatment and persons getting the care that they need.
That sounds absolutely fantastic, Dr. Nimrod. And I think it would segue straight into the Survivors Tribute Ceremony that is also carded for this year's conference. Can you give a little insight into that one?
Oh, yeah. So when you do something right, it's always a great idea to reward persons, to let them know how much we appreciate you. So we decided that we would come up with our Black Tie Ball this year, and this actually will be highlighting or recognizing persons who would have contributed in 5 different categories. So we're looking for the Oncology Innovative Blazer, Trailblazer. We're looking for a corporate, support for cancer in Trinidad and Tobago. We're looking at child advocates as well, because not just adults get cancer, children get cancer too. And sometimes children are making their voices heard. So we're excited to host that. We have 5 awards. So we're asking persons to make sure and come out. That's on this Saturday night. Contribution is $500. And let's support and cheer. And then we have our Cancer in Fashion, which is something I've been procuring for a while. So apart from pink and breast, there are lots of other colors that highlight the various cancer types. And we normally partner with the best designers in Trinidad and Tobago, as we say, and we get the information out there because health literacy is important. So trying to find other ways to communicate, because I've noted that some of my patients may not always be able to read, but if you put it out there in terms of drama or colors, or there are many ways to communicate to get the same information across.
And there are many days to communicate all of this information. So walk me through an actual calendar from the 11th to the 13th, as each event would have separate registration or costs associated as well, yes?
Right. So for persons who want to come for just the cannabis only, it's $200. So it went so viral that we decided to do day 2. So it was just one day. Now it's 2 days. So it's the Friday and the Saturday afternoon. And then for the cost of the conference, we tried to make it affordable for all 3 days for persons coming in. So the tiers are actually on our website at CAOH or from the flyer that persons can see. And then we go from there, and they get opportunity to interact with even the OECS. Some of the health ministers from the OECS and the Director General will be here. So we're hosting another landmark event where we'll be working with the OECS heads in terms of our first high-level meeting to see how best we can continue advising in that capacity.
Fantastic stuff. Now, granted that you referenced the website, will there be any sort of visuals or digital connection that we could utilize if we are not able to attend in person?
Yes, we're going to actually put out by tomorrow for persons who can't fly in or can't attend the Zoom link as well. So there will be that virtual option, which should be appearing on our website a little later today.
Well, it sounds fantastic and will yield a lot of innovations in the fight against cancer as we move forward. So we thank you for your efforts, Dr. Nimrod, and wish you the best from the 11th to the 13th.
Thank you very much. Hope to see you there.
Have a fantastic morning, and you too can be part of it, the 13th Annual Scientific Conference under the theme of Innovating for Equity, Advancing Cancer Care in the Caribbean, happening at the Hyatt Regency, July 11th to 13th. Head on over to the CAOHcaribbean.org site for more information, and stay tuned to the Now Morning Show as we've got more after these messages.
Still no major indifference of race, color, religion, or finance. It's amazing to you, I'm sure. We didn't get independence before.